Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeopathic Remedies for Prostate Problem. What is prostate? It is a walnut or pear-shaped gland situated at the neck of the urinary bladder and in front of the rectum in male. It is a part of the male reproductive system. Now look at the picture on the right side. This is a picture where a surgeon is palpating the prostate gland with the help of a finger. This is called rectal digital examination. This is bladder. Now at the neck of the bladder, this walnut shaped gland, that is prostate, is situated. Now generally surgeon enters the finger in the rectum from behind scrotum and palpate it, whether, and with the help of their finger they can feel whether it is enlarged, it is hard, or some pathological change is there. It can be palpated, and that is a very common disease performed by surgeon in his chamber. What are common problems of prostate? Number one, prostatitis. It may be bacterial or chronic. Generally, male less than 50 years of age are affected by this type of prostatitis. Now, benign prostatic hypertrophy, BPH. Males above 50, that is males over 50 years of age, generally affected. And finally, prostatic cancer. This can be affected by any person, but generally cancer is a disease of old age. So generally old persons are affected by this particular disease. Prostate and BPH. See, this is the urinary bladder and this is prostate. This prostate has got the, see this, this is normal urethra. This is seminal vesicles, that is from which semens are accumulated, and it comes out through this path through urethra during coition. It comes. Now the three parts, note the three parts, and the thickness, I mean the lumen of the urinary urethra, rather urinary passage and urethra. Urethral lumen, note the lumen, because in case of hypertrophy, now what happens? You see these things. This portion is projected inside the bladder. This portion also projected inside, and the lumen is, note, the lumen is completely, not completely, but to a large extent it is diminished. Both the seminal vesicles and urinary, both the lumen portion is been diminished in case of enlarged prostate. Prostate is shape of walnut. Its normal weight is 27 to 30 gram. What are the functions of prostate? Number one, production of prostatic fluid, main ingredient of semen, which carries, nutrifies, preserves sperms. Projects semen forcefully to the urethra using its own muscles. 3. Provides sensation of euphoria of men after ejaculation. 4. Provides strength to penile muscles, sustain excitation, and lingers time during sexual intercourse. Number 5. Healthy prostatic fluid inhibits infection of urinary tract. Number 6. Remove mycotoxin from foods and drinks of men. Mind it, removal of toxin, almost all glands of the body. Most important is liver. Liver takes the biggest part to remove toxin. Also in case of male, the small organ of prostate removes a lot of toxin. Now, while removing toxin, sometimes he himself is toxicated, and then serious disease arises. What are signs and symptoms of prostate problem? Prostatitis, discomfort in penis, in perineum, in abdomen, in lower back. BPH, repeated urge for urine at night, change in urine color or smell, pain during urination or ejaculation, cannot hold urge, urine leaks, flow intermittent, pressure feeling, bleeding after urination. Number 3, prostate cancer. Symptoms of BPH, all symptoms may be there, and difficulty in starting urination, loss of libido, blood in urine or semen, loss of appetite, weight loss, finally death may come. This is scrotum. From behind the scrotum you can feel also. Behind your scrotum you can, if you push your finger, you can feel this swollen mass. That is your personal, you, as a doctor, feel somewhere else, but you can feel from your behind the scrotum, you can feel it. Who are predisposed to prostatic problems? Number 1, aged men between 51 to 60 years, 50%, 80 plus, 90%. Number 2, family history, that is persons who has got in his family history this prostatic problem, the particular person may be also affected with the same disease. Persons with sedentary habits, that is another important thing. Sedentary habits is very much helpful to produce such a patient. Patients of diabetes, heart problem, and users of beta blocker. What are reasons of prostatic problem? Prostatitis, bacteria, or chronic. For chronic, nothing is known, it is unknown, but chronic prostatitis is there. Reasons is quite not known. BPH, increase in estrogen level in men. Now you may be astonished how estrogen comes here. Estrogen is a female hormone. But mind it, all types of hormone is present in everything, every person. We male think that we have got only estrogen. Estrogen is also there in ladies also. Estrogen, progesterone in ladies hormone, it is also there in us, because basically every human being is bisexual in nature. I am man because masculine character is more than feminine character, so I am a man. Someone is lady because feminine character is more, so she is lady. Prostatic cancer. Hereditary, certainly. Hereditary, lifestyle, meat, wine, smoking. These are helpful for producing cancer, and obesity. General management of prostate problems. No disease state is completely cured by remedies only. These are very fundamental thing. Plus, listen and try to realize the significance behind the lines. Some preventive managements are always compulsory to be followed by subjects all along afterwards. That is after taking medicine. Please mind that unless these are followed carefully, disease would recur again and again. Many one reports that when I take the medicine, I am good. When I drop it, the disease back. Because this may be one of the reasons. You cannot be completely cured with the help of remedies. Some procedure, some step, some style, some performance you have to perform always. Modification is required in the daily lifestyle. What is number? Hot and cold water bath. It's very important. In your bathroom, make arrangement in such a way that scrotum and its adjoining area, perineum, from perineum to root of penis, is plunged into warm water for 2 minutes. Repeat the same with cold water for 2 minutes. This is one cycle. Perform this cycle and perform this for 3 cycles at least. Now what happens here? When you are in the warm water, the area around whole perineum, that is around the prostate, is this particular portion is warmed. That is, it is expanding. When you are in the cold water, it is compressing. Then if a particular portion is expands and contracts, then the blood supply in the region increases, and increases blood supply always energy, gives energy to the particular organ. So by this way, we are innervating the prostate itself. When prostate is innervated, he can throw out the toxin which is already absorbed in his structure. So this is a very interesting physical thing. There's no taking of medicine, nothing, just physical. Warm water, cold water. Number 2, try sit up, push up, abdominal crunch. All these exercises just give maximum pressure in perineum region, in lower abdominal region, and innervate the gland. Number 3, practice Gomukhasana, Vajrasan. those who practice asan, they know these two asan are very interesting asan to innervate the prostate. Number 4, jog or walk for at least 15 minutes so that a few drops of sweat come out. This is a very, very good thing. When you perform some work and drops of sweat comes out, then you are successful. Avoid all sorts of addiction, meat products, coffee, ice cream, colas, canned, tinned, packet foods with trans fat. Take adequate pomegranates, bell peppers, citrus fruits, veggies, broccoli, kale, tomato, pink grapes, soybeans, pumpkin seeds, all greeny leafy vegetables, green tea. Control body weight. BMI, body mass index, must be within 18.5 to 24.9. Take 2 to 2.5 liter of water daily. Have sound sleep for 7 hours. Keep stress under control. And this stress has been known to be a factor in almost all cases. All diseases, whether it is physical disease or mental disease. Stress is a factor always. Don't be tab or cap happy. That is, do not take tablet or capsule for slightest reasons. Give your body time to adjust, to react. Don't take tablet capsule, slight pretext. Please, this is a very important thing. Note it. Now the remedial treatment. Thuja occidentalis for prostate problem arising out of syphilis or psychosis, especially maltreated gonorrhea, stitching in urethra from behind, from scrotum to bladder, deep perineal pain, dysuria, pain in urination, with retention, frequent urge in evening, warts from lying down, stream interrupted repeatedly, cutting pain at beginning, pain descending along urethra up to external orifice. Lycopodium clavatum for prostate problem. During and after urine, pressing in perineum, stitching at the neck of bladder and anus at the same time. Has to wait a long time before flow start. Retention. Retention means holding up of urine. Subjects fond of hot food drinks, sweets, averse to tobacco, bread, coffee. They sleep with half-open eyes. Subjects means patients. These are his general symptoms. These are his particular symptoms relating to disease. Bariatric card for prostate problem. Hypertrophy in old men. That is, bariatric card mainly for old men. After urination, renewed straining with dribbling. Numbness in genitalia for minutes together. Frequent urge for urine, no stool. Subjects young, bald-headed, childish old people, idiotic, habituated to masturbation, premature impotency, used to talk in sleep, catch cold very easily with affection, limb dreads. Staphysagria for prostatic problems. Frequent urging with scanty discharge of a thin stream of red urine. Sensation as if bladder were not emptied. Pains extending from anus along urethra. Coming on after walking, cycling. Sometimes copious and frequent urination with burning along the whole urethra. Subjects crave tobacco intensely, suffer from weakness of memory and sexual excesses with tendency to dwelling on sexual subject. This symptom relates to the staphysagria patient. These are disease symptoms. Digitalis for prostate problem. Senile hypertrophy with marked cardiac symptoms, dribbling of urine with constant sensation of fullness after micturition or fruitless efforts. After a few drops passed, increased desire to urinate. Urine pale, smoky. Motion increases urge to pass urine with frequent desire to defecate. Soft stool passed without relief. Subjects often in cyanosis of face, eyelid, lips, tongue, nails. Cyanosis means bluishness of the particular part. These are actually very serious symptoms. When patient gets less oxygen, generally then the cyanosis starts. Face covered with cold sweat. Passerella for prostate problem. While lying on back, continuing dull stitch at neck of the bladder. Spasmodic pain there extending to pelvis and thighs. Prostatic troubles of elderly people. Stool flat, small in size. Stool flat means the enlarged prostate, pushing the stool to be flat. Because prostate is placed in relation to rectum. Small in size, greater the pain, more severe the chilliness. Pain comes suddenly, goes gradually, or the reverse. Subjects suffer diverse symptoms with frequent changeability. This is a characteristic of ulcer patient. These symptoms changes very often. Despite chilliness, they prefer open air. Cornea maculatum from prostate problem, enlargement with induration of prostate without voluptuous thoughts, discharge of prostatic fluid while passing stool with itching of prepuce. Prepuce means just orifice of the urethra. Pressure feeling in the neck of bladder with stitches. Worse from walking, better when sitting, weight like a stone in the perineum. Subjects tend to attract malignancy. Conium is a good medicine for malignant cases. May suffer from ascending type of paralysis and vertigo. Benzoic acid for prostate problem. Urine smells like that of horse's hot, dark brown, strongly ammoniacal, dribbling of old persons, dysuria with enlargement of prostate, weak feeling in loins. Causticum for prostate problem. After passing a few drops of urine, pain in urethra, bladder, spasms in rectum with renewed desires, pulsation in perineum, obliged to pass urine every few minutes at night with externally painful pressing and arching, chronic prostatitis, contraction of sphincter with excoriating serous discharge from anus. Subject feel great sympathy for other sufferings. Causticum patient always feels other problem much more than any other person. Here they are so much sympathetic. Worse in clear fine weather. They feel worse in clear fine weather, better in damp wet weather. Suffer from weakness in memory and absence of mind. Selenium in prostate problem. Discharge of prostatic fluid while sitting, sleeping, waking, passing stool. Involuntary urination while walking. Dripping after stool or micturition. Stool hard, impacted. Requires mechanical intervention to remove. Subjects feel worse after sleep in hot weather. With this, the video ends. Thanks for listening, viewing. If you feel any trouble, please write down in the comment section. I will certainly reply.